Thanks to each of you for jumping on with us. Um, I'm very excited to be able to make this introduction today. This is something that we've been thinking about doing for quite some time, and Dr. Mead generously agreed to do this presentation for us on PCORnet. Dr. Mead is joining us. He has been a program officer at PCORI. He is currently with PCORnet. And his area of emphasis is he focuses on supporting and advancing the research network. We were just talking about the fact that he did his PhD in colder climates too, and he can tell you a little bit about his background when he jumps on, but he's been involved with PCORI and PCORnet related activities across a number of years and across a bunch of different units. And he's here to basically give us an overview and give us some practical perspective on how PCORnet resources could be a resource for all of you in your research program. So thank you, Dr. Mead, for taking the time to do this today. We're very happy to have you here.
Great. Yeah, thank you so much for the introduction. My name is Mike Mead. I'm a program officer here at PCORI. As previously mentioned, I did my PhD in health psychology in Fargo, North Dakota. So come from a more of a behavioral health background, joined PCORI. And I've had a couple different roles at PCORI that I want to highlight before I get into today's talk. Just to give a little bit more context about hopefully sort of this type of information I can provide today. So when I first started at PCORI, I was working in the clinical effectiveness decision science, where we house our CER. And so I was a program officer working on the different topic themes, managing funded research projects, working with projects coming through review. So I have a lot of experience with just in general the PCORI funding opportunities. And then last year I transferred over to research infrastructure as a program officer working with PCORnet. So I'll be talking a little bit about both PCORI and PCORnet today. And I do want to note too that PCORI and PCORnet are not the same entity. PCORI, as you know, or as you may know, is the research funder in Washington, D.C. that funds comparative clinical effectiveness research. Then PCORI funds PCORnet, which is the research infrastructure that I'll be talking about today. All right, so here's just a brief overview of what I'll be speaking about. So just do a brief PCORnet overview, talking a little bit about using PCORnet. I'll highlight a couple of recent case studies about research using PCORnet, and then finish talking about PCORI funding opportunities, including ones that overlap with the use of PCORnet. So PCORnet is a national resource funded by PCORI to be open to all, where high-quality health data, patient partnership, and research expertise hope to deliver fast, trustworthy answers that advance health outcomes. And PCORnet is designed to improve the nation's capacity to conduct patient-centered health research, particularly patient-centered comparative clinical effectiveness research, or as we call often shorthand at PCORI, a CER. And also to learn from the healthcare experiences of millions of people to allow for large-scale research to be conducted with both enhanced accuracy and efficiency. And PCORI funding on PCORnet supports the development of reusable, continuously improving research infrastructure at local, regional, and national levels. So I think I went a slide too far. All right, so PCORnet clinical research networks, or what we call CRNs, are groups of diverse healthcare institutions from across the country, from large academic health centers to local community clinics. And the clinical research networks work to capture complete longitudinal healthcare data on their patient population, which primarily include EHR data from both ambulatory and inpatient care, and also to a lesser extent, claims information or other records representing care received outside the delivery system. And the map shown here highlights the location of the sites participating in PCORnet, of those academic health centers and local community hospitals. And these are color-coded by the different CRNs. So as you can see here on the screen, we have 8 different clinical research networks that are spread across the country. And then on this slide, this is a list that provides the different clinical research network sites and the institutions serving as the coordinating center for PCORnet. There's a lot of lists of different sites here on the screen just to show the breadth of our CRN sites. But in addition to the sites, I want to show how this is captured across the country. So PCORnet includes data on healthcare encounters on more than 47 million people across the US annually. As you can see, we're here in all 50 states. You can get a sense of the patient coverage across the US with darker shades indicating more people. So we have what's called the PCORnet Common Data Model, or we often refer to as the CDM. And this is considered one of the major achievements associated with PCORnet. This data is research ready at a national scale. It includes data from all of the data contributing partners. This data is standardized and it goes through quarterly curation cycles. On the left side, you can see the domains of the CDM that are available across clinical research networks and are research ready, including demographics, diagnoses, and clinical observations. On the right side, you can see the domains that are available but may require additional work to be research ready. This can include immunizations, social determinants of health, and patient-reported outcomes. So this slide shows the process by which the Coordinating Center for PCORnet can assist in the development of a network query. Through this process, a requester can submit a question through the front door, and the Coordinating Center works with the requester to develop the network query. This query is then sent to network sites and run locally. Finally, responses are returned to the Coordinating Center, which sends the response back to the requester for their use in proposal development or site selection. Please note that since PCORnet is a distributed network, all site data remains locally behind institutional firewalls to maintain the highest levels of security and privacy. Also want to note too that this process is open to all interested investigators and research partners. All right, so PCORnet participants prioritize meaningful engagement in research. Patients and caregivers are involved in the infrastructure and governance and in all phases of the research process. All the clinical research networks also have existing relationships with patients and caregivers, along with standing engagement resources. Patients and caregivers weigh in on study approaches, provide input based on patients' life experiences, and define meaningful outcomes as well. There are many PCORnet resources that investigators cite. They use, and I'll list a few that are included in this. First, engaging with the PCORnet front door for prep to research activities, such as conducting a prep to research query to inform study design, by participating in the network collaborator request process to identify partner sites, or using the front door study feasibility services to inform effect sizes, power calculations, representativeness, and price estimates for budgets. There's also using PCORnet tools for study startup, including the data sharing agreements, clinical research collaboration agreement, or also SMART IRB. Partnering with PCORnet sites for recruitment, using the PCORnet Common Data model to generate recruitment lists, collect baseline or outcomes data, or link to other data sources. Using engagement resources such as identification of or connection to patients or community representatives for participation as study partners, or use of a clinical research network stakeholder advisory board or a similar body to provide input during the course of a study. And then lastly, of these things cited, taking advantage of dissemination channels, including distribution to organizations that participate in PCORnet, or sharing study information via the PCORnet website or best practice sharing sessions. Now, I want to say a few things about the PCORnet front door, because this is really an important entry point for a lot of people who are interested in using PCORnet. So to work with the network, anyone can contact the PCORnet front door through pcornet.org. The front door can connect requesters with services like prep to research, data for proposal design, connections to network partners, and resources including engagement expertise, or to identify potential sites for study participation. The front door can also offer cost estimates for using PCORnet resources, which will be included in an applicant's study budget if they are awarded and plan to use PCORnet. So another great resource that PCORnet has is the PCORnet Playbook. And the PCORnet Playbook is your guide to using PCORnet. Whether you are a researcher, patient or community partner, clinician, caregiver, or part of a research team, this resource is here to help you understand how to use PCORnet to support patient-centered health research. And through this, you'll learn how to use PCORnet resources to find fast, trustworthy answers, how to design high-quality, large-scale research projects using PCORnet services, including engagement, data, and outreach support, and also what to expect when collaborating with PCORnet network partners. And again, there's a URL on the screen there that can bring you to this playbook. All right, I want to transition just a little bit to talk about what are PCORnet studies. So PCORnet studies are studies that meet a higher bar for PCORnet involvement. Studies that meet the criteria listed on the slide qualify to be a PCORnet study. And this designation represents a study that has a deeper level of partnership with the network rather than just using some PCORnet resources. In addition, these studies receive certain benefits, including getting permission to use the PCORnet name and logo, receiving support across the network in the form of regular communications with PCORnet experts who can help with understanding network operations, pragmatic research designs, and best practices for patient centricity. And then lastly, research teams working on PCORnet studies also share monthly performance metrics, which can help foster shared learning across the network. All right, before getting into a couple case studies, I want to highlight the PCORnet infrastructure capacity for national scale patient-centered CER and also other health research. As of August, the network includes data on healthcare encounters on more than 47 million people across the US annually for more than 13,000 sites of care. There have been 57 PCORnet studies resulting in 644 million in research funding and over 991 publications supported by PCORnet resources. All right, now I just want to briefly highlight two case studies that have used PCORnet. The first is the ACTIV-6 study. This is one of the accelerating COVID-19 therapeutic interventions and vaccine studies that were started up rapidly during the pandemic and funded by the NIH. It is a randomized clinical trial and PCORnet study, which has investigated whether a number of medications already approved by the FDA help people with mild to moderate COVID-19 feel better faster. This study used a decentralized trial design, using features like online enrollment, consenting, and randomization. Study medications were shipped to participants' homes, and data collection through online and phone surveys, all of which allow participants to participate from their own homes. Use of this approach has resulted in the study's ability to recruit racially and ethnically diverse populations. For example, the most recently published results include an arm that had over 60% Hispanic and Latino participants. All right, the second study is the President D study. So heart disease is one of the major causes of illness and death in type 2 diabetes, and type 2 diabetes affects over 32 million Americans. Of this group, approximately 20 million people also have heart disease or have very high risk for heart disease. Recent large studies have shown that two new classes of diabetes medications called sodium glucose transporter inhibitors and glucagon-like peptide 1 receptor agonists reduce heart attack, stroke, kidney problems, and death in people with type 2 diabetes and heart disease or high disease risk. However, it's not really clear which medication class is better for people with these conditions. And so this study seeks to test which medication treatment is most effective at reducing major health events such as heart attack or stroke in adults with type 2 diabetes and heart disease or high heart disease risk. Notably, the study utilized PCORnet to enhance its research aims in several ways. First, it's recruiting participants from PCORnet healthcare systems across the United States. Second, medical outcomes are being captured through data queries of the PCORnet Common Data Model. And lastly, they engage local patient stakeholders and PCORnet investigators on project design and outcomes. Okay, so that's a very brief overview of PCORnet and how it can be used. Now I want to transition a little bit to talk about PCORI funding opportunities, including opportunities that include the use of PCORnet. All right, so this gives a brief overview of the different PCORI funding announcements. I'll take a really quick step back too, in case you're not too familiar with PCORI yet. So PCORI funds comparative clinical effectiveness research, and so we are really interested in funding research that compares at least two different treatment options that are either currently used in clinical care or have a high evidence of efficacy. And importantly, we really want to make sure that the results from the study are going to inform decisional dilemmas for patients and providers and lead to a change in clinical practice. And so, going off of that, this slide gives a really quick preview of our funding opportunities coming up for 2026. And I'll note too, before I talk a little bit more about these in particular, a lot of these, including the BPS methods, engagement, and placer, these occur three times throughout the year. So first, I'll start with the broad pragmatic studies, or what we call our BPS funding opportunities. This funding opportunity seeks applications addressing four of PCORI's national priorities for health, which includes increasing evidence for existing and emerging innovations and accelerating progress toward a learning health system, and advancing the science of dissemination, implementation, and health communications. The BPS PCORI funding announcement allows three award sizes with varying requirements or limitations. Topics can be very wide-ranging, but applicants are strongly encouraged to propose individual or cluster randomized controlled trials. However, well-specified natural experiments and well-designed observational studies will also be considered. Next are our method studies. So PCORI's portfolio of methodological research supports methods work that will ultimately improve the design and conduct of CER. There's also the Science of Engagement Awards. These are multi-year efforts to build an actionable evidence base that clearly identifies the methods and approaches that lead to effective engagement in research. Occasionally, we have focused or topical funding announcements as well. These are issued on an ad hoc basis throughout the cycle year and are focused on specific high-impact topics aligned to our board-approved topic themes. And the aim of these is to produce evidence that will have a substantial impact on practice and patient outcomes within that particular topic. The last one I want to highlight are our PLACER Awards, which stands for the Phase Large Awards for Comparative Effectiveness Research. These are easily our largest funding awards that we give out. And our PLACER supports large-scale, high-impact randomized trials in CER whose risk in achieving their research aims merit an additional period of testing and refinement to determine their feasibility and viability and maximize the likelihood of a full-scale success trial. So oftentimes for these, there's a 2-year initial phase, and then if successful, can move on to the full trial phase. So I just want to end this slide by saying I really encourage you to visit PCORI.org to review the detailed announcements. If you have not already done so, sign up for PCORI emails to receive notifications of funding opportunities. Now, what about PCORnet? So I want to spend a little bit more time talking about the broad pragmatic studies or BPS funding opportunities. So in 2023, PCORI implemented a third category to our BPS funding announcements to support PCORnet studies that advance PCORI's national priorities for health. To qualify for Category 3, studies must address the national priorities for health, including two or more of the PCORnet clinical research networks, share monthly study progress and performance metrics, shared best practices at least once per year with the network, and use PCORnet resources to improve the efficiency of the patient-centered research. I want to quickly note here, because this is a question that I get often. Please know that you do not need PCORI funding to use PCORnet. That's a really important note I want to say. So you can have funding from other sources and still use PCORnet. All right, so budget-wise, for these Category 3 studies, total direct costs must be 12 million or less. If greater than 5 million, then additional information must be provided to justify the scope of the proposed research, why additional funds are necessary given the scope of the project, and are subject to additional merit review considerations. All right, lastly, there are a few additional Category 3 requirements for this. Category 3 applications must contact the PCORnet front door before submitting the letter of intent, and this front door number must be included in the LOI. And I'm happy to answer some more questions about the LOI process too, because it's a bit of a unique thing about PCORI. If your LOI is accepted and the full application letters of support from at least two clinical research network sites indicating their agreements to participate, these must be provided. Funded PCORI studies negotiate a list of milestones with PCORI staff, and there are Category 3 specific milestones that must be included. First, study progress and best practices must be regularly shared with the network. Second, study site metrics such as enrollment rates must be reported monthly to the Coordinating Center for PCORnet. All right, on this slide, you can use the QR code to learn more about the PCORnet front door. We also have some social media accounts. We have the PCORnet newsletter you can sign up for as well. So there are many different ways to learn more about PCORnet. All right, and that's the brief overview that I had, which leaves plenty of time for different questions. I'm happy to do what I can to answer any questions. I will note that PCORnet is vast and complicated, so I will do my best to answer any questions that you have. And if there's anything I'm unable to answer, my email can be shared, and you can follow up with me at a later point too, in which I'll give you a much more precise answer if there's something I'm able to answer initially. So yeah, thank you very much for your time, and looking forward to discussing more.
Thank you, Dr. Mead. I appreciate the fact that you wove both the broad pragmatic and the PCORI elements into it to make the connection. So I see Dr. Landsiddle has turned on his screen and has his hands up. Dr. Landsiddle runs our Department of Biostats here at UB, and he has reviewed for PCORI a million times. So Doug, you have a question?
Yeah, thank you. Thank you for the excellent talk. That was very helpful. I'm just curious, in terms of using PCORnet for large observational studies. I know there was a PFA came out recently, which some in our group applied to for the large retrospective studies. My understanding is the broad pragmatic studies can be observational, but it seems that uh, randomized trials are preferred. I'm just wondering if you can comment just in terms of moving forward, how you see PCORI funding the studies that are strictly observational using PCORnet, and if there are other kind of things I'm missing, or in particular, I was curious if that funding mechanism was going to be coming back after this one time. Thanks.
Yeah, thank you. That's a really great question. And thank you also for reviewing for PCORI. Really appreciate your time on that. So a couple things on that. You did mention the PFA with the observational focus. I am not able to speak about the longevity of that. Some PFAs are recurring for PCORI, some are one time only. So I do encourage you to please sign up for emails in case that putting a funding announcement does come back. Um, I do want to make the distinction again, though. You can use PCORnet for observational research without having to go through PCORI. So regardless of whether PCORI continues to have some extra efforts to fund observational research, PCORnet is still a resource to use for observational studies outside of PCORI funding. So that is always there.
Okay, thank you. Can I just ask, is there any sort of thing you can say further in terms of the broad pragmatic studies? Am I correct that it is possible to fund observational studies, but generally randomized preferred, or is that a reasonable interpretation?
Yeah, I think that's a good interpretation, and a couple more things on that. First, PCORI is really bound by the legislation that found PCORnet, and so we are really bound to comparative effectiveness research. And so even like the observational work has a tint of CER to it. If you do have more specific questions about whether a observational trial would be within scope for PCORI, then what I recommend doing is reaching out to PCORI to speak with a program officer. So as I mentioned, I used to be in the CER division, and I had dozens of meetings with interested investigators about the research. We really do enjoy meeting with researchers who are interested in PCORI, and so what's really helpful is if you, when reaching out, include maybe a summary of the type of research that you are thinking in, so the program officer can have an idea of what they're going into for the meeting, and then we can have a really good discussion about one, is this something that is within scope? And two, if not, that like maybe how can it become more within scope? The PCORI program officers cannot be prescriptive, so they will not be telling you this is what you need to do to make this more within scope. But we can have an honest conversation about the details of the study, whether it's in scope or not. So I think that I hope that's helpful.
Yes, thank you.
Yeah.
Do we have any other questions for Dr. Mead? Dr. Waller?
Hi, and I apologize, I missed the first 5 minutes, and maybe you answered this question at that point. Presently, we're working on a project. Long and the short of it is trying to validate an update on what's called the drug burden index. And I was looking at the different data points that you have, and I think you would have what we would need. Presently, we're looking at the linkage program that the NIA has between NHATS data and Medicare Part D data, but you might have more real world data. I guess my question is that knock on your front door, is that you have the existing data that we could run something like this, or you would go prospectively and get the data that we would be looking for? And the data that we would need was on your right hand column. I can't remember the slide, but it was more of the functional and cognitive outcomes. Oh, so your patient reported outcomes there. Although it might be in clinical observation. So long and the short of it is PCORnet available for doing that type of study, or is it prospective that you would then go get that data?
This is a great question, and there's a lot of flexibility within PCORnet. I think this is a perfect example of how reaching out to the front door would be really beneficial. Since PCORI and PCORnet are like different entities, I do not have great knowledge of actually like, what data, or I'm not the person to talk to for a question like that to see if the data that you are looking for your type of study or the infrastructure of your type of study is available. That is a really good question for the front door, and they'll be able to answer that for you.
Okay, appreciate that. Thank you.
Yeah, of course.
Anybody else?
Um, Jill, this is Michael Donnie. I had a quick question.
Sure, great. Dr. Oldani leads our interprofessional practice and education program here at UB.
And I'm glad Bob brought up the slide. I was curious where you say available but still evolving. Are you able to talk a little bit more about what you mean by patient-generated data and patient-reported outcomes is kind of straightforward, but I was wondering if you could say a little bit more about that.
That's a really good question. So a lot of the on the screen here, a lot of the data is pulled from like EHR and other metrics, similar metrics, but the patient-reported outcomes, sometimes these can be a little bit harder to um, access and pull and then translate into the common data model. And so these are as it shows the patient-reported outcomes that just take a little bit more time and efforts to pull together into the CDM. As to what is actually included in those and how we categorize those, that is another question for the front door to see if they have what you're interested in for that. So again, if you're interested in what is more information about what's included and available, and what may need some more work, again, I encourage the front door. I'm sorry I can't give a more precise answer to that, but I hope that's helpful.
Yeah, thank you.
If you're talking, I think it might be on mute.
Oh my gosh, how many years have I been doing this? Sorry. Yeah, yes, I just wanted to say thank you on behalf of UB and the health sciences. Truly appreciate you taking the time to prep all of this and share it with us. And just generally speaking, you and your colleagues have always been so easily accessible and just so helpful, and it's recognized and appreciated.
Yeah, of course. Thank you so much for your time. Thank you for all of your interest, both in PCORI and PCORnet. And again, I'll say one more time, if you have any other questions, please don't hesitate to reach out to PCORI program officers through the PCORI website to the PCORnet front door. We're always happy to try to help in any way that we can.